Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Tonight, we are chatting about childhood abuse and intergenerational trauma and how it affects us as we grow older. With so many of us migrating to the Western world for a better life for ourselves and for our children, are we still carrying our cultural burdens with us? Meet my two guests, Dr. Amita Sarkar and Dr. Jyothsna Rao. Jyothsna is actually my co host tonight, and we are going to talk about what exactly is childhood abuse and what is intergenerational trauma. But before we start, I would like to acknowledge the traditional owners and custodians of the land on which we are meeting tonight. I also pay my respects to their elders, past, present, and emerging. Hello, ladies.
Hi Amita. Hi
Hello.
Saleha.
Hi, Saleha. Thank you for inviting me.
No, thank you for coming over. I can already see people watching. So before we start, and I let Josna um, start off with her questions, can you tell us something about yourself, please?
Sure. I'm a clinical psychologist and I have worked across different countries. About 27 years, 28th year of practice now. And I work primarily with children, adolescents, and families. But the aspect of my work that I want to highlight today is I've been working with the family courts for a number of years. So that started in England, in UK, and then also in Singapore, and more recently, Children's Court in Victoria. And it's about child protection matters that come to the court, more severe end of, I would say, child abuse and child maltreatment issues. My cultural part of what I do clinically is also my research interest. So I'm interested in how culture mediates between mental health and personality or parenting, and also helping parents around these issues. So working often with the people from different culture backgrounds.
Thank you. So, what exactly is child abuse and how does it affect a child as they grow up?
Well, when we talk about child abuse, over the years, with the legal system protecting children, have been laws around it. Also, researchers, psychologists, clinicians have paid attention to how it looks like. So, broadly, there are three types, three categories that we divide it into. So, there's physical abuse, there's emotional abuse, and there's sexual abuse. And a connected part to that is psychological or emotional neglect. Child abuse is basically any way or form where an adult caring for the child has perpetrated an act, has behaved in a certain way that impacts child either physically, emotionally, sexually, or does not meet child's needs. So that is the neglect part. And just to give you some basics about signs and how it looks like in children, what are kind of these three different categories. So physical abuse, we simply think it's about like hitting a child, slapping a child, but it can also be other forms like burning a child. I've seen a matter where a parent was trying to punish a child putting her finger in the oven to say she remembers next time doing her homework. Shaking a baby, um, or kind of violently uh, tackling a baby, pinching, or even other ways of holding them tightly, putting them in a stress situation. Those are the things that are physical abuse. There's also another kind of physical abuse, which is medically called Munchausen by proxy, which means the parent starts to believe the child has some illness. So they keep taking the child to different doctors, hospitals, just to satisfy themselves. And that is a kind of a physical, but also emotional abuse to the child. When we talk about emotional abuse is not hitting or hurting the child physically, but also using psychological ways. So, shouting at child, ridiculing a child, telling them, calling them names, or labeling them as bad child, or constantly demeaning a child, devaluing a child. Also, emotional blackmail. ऐसा नहीं करोगे तो हम तुमसे बात नहीं करेंगे. Lot of parents do that, and that silent treatment is also emotional abuse. Um, Thirdly, when we talk about sexual abuse, which is often quite hidden and covert, but it broadly means that any kind of sexual exposure to the child. So it could be a sexual act with the child, or
A
even
sexual act with a child, parents,
it's not only parents. Sometimes there could be people who are in the
family.
extended family or friends, or um, someone who knows the child well, and often that's and I'm not saying it's always known person. There could be strangers too, but sexual abuse could be a child being compromised, or a staff at school, any person who knows the child and taking advantage of exploiting the child into that compromised behavior. And children as young as school age, they do not understand what sexual behaviors are, and they don't have any kind of developmental level where they can participate in it. But including a child in that kind of act, or exposing a child to videos or a material, that also is counted as sexual abuse. So they are kind of these three different types that we broadly categorize into.
Amita, we have a question. Thank you for watching, Chris, and always supporting me. If a father happens to abuse his own daughter, how can we save that child from lifelong trauma?
Well, when we think about protecting the children, first of all, if it's in the knowledge of the other parent, that's mother or father's partner, I think responsibility of that adult is to allow the child to have the enough protection, because otherwise the state, the government will have to intervene and protect this child from both these parents. So one parent is involved in child abuse by actively abusing the child, the other parent is involved passively by not protecting this child. So if just to answer your question more specifically, step one is reporting that. And I need to say that by law, in Australia and in many other countries, um, reporting child abuse, especially sexual child abuse, is mandatory. So if any adult gets to know, if it's a neighbor, a friend, school, doctor, and we as professionals, if there is a disclosure that child comes to see a dentist and then tells the doctor about what's happening, it is mandatory reporting, and then there will be investigation around it.
Yep. So there's no
Long
privacy there. Yep.
No, it's not about the privacy of a family. It's about protecting a child's
Yep.
rights and protecting a child's well-being. And then long-term impact, I would say, if it has already been detected and it has come to the notice and child has been protected from that abusive adult, then play therapy, psychological therapy, support to this child, environment, giving them a home environment where they are loved and cared for. Those are the things that can heal a child over time emotionally.
Thank you. Continuing with that is another question from Chris, which is, how do you deal with a situation where a mother consciously or subconsciously tries to compete with her own daughter? Yeah, this I know.
Great question.
Well, it's very interesting because consciously or unconsciously are two very different things. So, something that the mother knows is happening, or something that the mother doesn't know unconsciously, she
Yep.
behaves. It's like a parent getting into a competitive, a sibling behavior with a child, where we have to look back. We have to look back how this mother was brought up, whether she had any history of abuse and emotional neglect. That's something we'll talk a little later about. But
Yep.
emotional abuse and emotional neglect can also manifest in the way of a person feeling insecure, feeling not positive about themselves. And when that mother sees the child growing up, one part of them is like consciously they are the mother and they have to look after, but the other part, I mean, it's hard to explain because you can't see on x-ray or any machine, but mind has got an unconscious side where this mother starts to feel envious of this child. Mother starts to feel that I didn't get that childhood that my child is getting, And that's where this competitive behavior can start. Look, I'm better than you. Sometimes parents do that overtly to say, हम लोग को ये नहीं मिलता था, हमारा होम पॉकेट मनी नहीं था, हम बाहर नहीं जाते तो तुमको क्यों करें, इतना पैसा क्यों खर्च करो, all these things. But unconsciously also there could be a way of kind of trying to demean the child, trying to show the child that you are less important, or I'm better than you. Again, these are the situations where family therapy, getting this mother and child adequate help, and getting this mother some help to see what she's struggling with is important.
Thank you. Joe, you want to ask Amita anything?
Yeah, so this is actually a nice segue into the determinants around violence in the home, because a lot of research and stats say that a woman and her child are unsafe at home. So, what do you think? And and this is something we work with. So, I'm Jyothsna Rao from Indian Care. I'm the manager at Indian Care, and one of our cohorts is South Asian women who are experiencing violence. And Indian Care works in early, primary prevention and early intervention. So, we know that family violence affects not only the woman, but also the child or the children and community as a whole, including support services staff. So I'm very curious to know what you think. How does this then feed into that violence in the home? Because South Asian women have a high threshold for violence and
Certainly.
can
And pain.
compromise
Yep.
and
Mhm.
pain. It's not about that chai jo thandi hai ya garam hai. It's about a lot of other things. Samjhauta kar lo. That is the
Mhm.
most
Yep.
common advice we get.
खाना
So,
बना लो, अच्छा
hmm,
खाना बना लो. हाँ.
hmm. So yeah, that's my
So,
question, Amita.
yeah, if we use the same framework of the definition of child abuse, um, domestic violence or family violence is actually the ideal foundation for starting child abuse, because what happens there, and again, in family violence, in domestic violence, as you say, it's not always like violence means hitting the woman, or beating her, or using force, but it's also about emotional abuse. So a lot of demeaning the person, controlling them, coercion and control behavior by the partner. And in that situation, there are two ways we have to look at. One is child as a witness of domestic violence. So sometimes they are, and that interestingly sometimes happens differently into the genders. So sometimes men would be abusing women, but the son in the family is quite well looked after, whereas daughter is not. So there are gender differentiations there. And now this little boy, he grows up seeing that his mother can be controlled and demeaned and abused, and she has no voice, she has no power. And there are research studies which have shown that children, if they grow up in a violent family, even though they were not victims of violence, 80% of them would baby witness of at least one episode of wife assault. So sometime we see that there is a huge possibility that if child is exposed to domestic violence, they learn that violence is a fine way to behave. It is a way of negotiation in a relationship, and this is how you sort out the conflicts. Second part of that is when child is also a victim of domestic violence, and that's where it gets more tricky, because then the child also bears the trauma of seeing the parent, one parent, being abusive to others. So the sense of helplessness of their mother or father who is getting abused is getting instilled in the child. But also sometimes children get physically hurt. They are trying to protect the parent who is getting abused, or they are saying something to stop the abusive parent, and they get hit and they get a slap or hurt. Uh, and a lot of time that can have more long-term dent on child's personality and well-being, because that child grows up feeling scared, feeling anxious. And another piece of research is a lot of time women who saw a lot of domestic violence in their own family, they grow up believing that that's okay, and they often end up in abusive relationships. Not that they choose to do that, but they allow it, they accept it as a norm. So domestic violence is really one area which needs to be tackled. It's directly related to child abuse and prevention of children from this abuse.
Um, Talking about, children growing up, women growing up in families, seeing domestic violence, and then it carries forward, and they marry into families where domestic violence again. I mean, you said that she unconsciously she gets into a relationship where domestic violence is accepted. So this is what Chris wants to know, and I think it's very timely. When you speak of intergenerational trauma, how can you take a reluctant parent to therapy, a parent who is in complete denial that something is wrong? And Amita, I can tell you first-hand
Mhm.
experience. Um, I was contacted by two ladies asking me to help somebody as part of Indian Care,
Mhm.
and that lady did contact me, and we know she was in a in an abusive relationship. There was family violence, and I said, I'll help you, tell me what you need. And she's like, I can't talk now, I will come to you when I'm ready. And
Mhm.
she is just one example, but there have been three examples in, I think, since October last month,
Mhm.
September, October. So in the last couple of months, three women just
Mhm.
not accepting it, because it's easier not to accept.
And that's a very relevant question that takes me to the talking about what are the possible reasons why parents are abusive or why partners are abusive, why there is violence in the family home in the first place. We don't get married or we don't have kids to perpetrate abuse on each other. So basically we have to look at possible reasons, what's going on with this family, what's going on with this parent or with the partner, um, person who is perpetrating violence on the family. Possible reasons can, and I'm not saying that's majority of cases, but in some cases there could be mental health issue, there could be a problem within the person going through depression, anxiety, going through more serious mental health problems, or even sometimes there are personality issues that people are more violent because of the nature of their personality. And those are the aspects where mental health professionals talking to your GP can help, because your GP can direct you in the right direction to say if there is any individual help that is needed. Someone losing a job or having some social problems or relationship problems because they have financial issues, those social and emotional things are quite related. So getting appropriate help is important. The other part of it is often people don't talk about it because again it becomes a norm कि शाम को आके थोड़ा सा पी लिया कुछ किया. Alcoholism seems to be a very common problem and very much linked to abuse in the family and child abuse. And people stay in denial for a long time because they don't think it's a huge problem. This is what I do to relax every day. But they don't realize that it is having an impact on their relationship and their parenting. Now, the other part of it is the severity of the level of problem. So, sometimes we find parents are not able to understand that this my behavior is impacting adversely. What I'm doing, I've seen my parent, my grandparents, intergenerationally this has happened. So, हमारे देश में ऐसा होता है तो हम भी कर सकते हैं. हमारे यहाँ तो सब बच्चों को मार सकते थे या बीवी को बता दो कि कंट्रोल करना ये सब जरूरी है. But important part is these are the people who actually don't realize that they are driving their family to a point where it can actually come to a breaking point. And let me warn those families that if you don't take an action, somebody else will take an action. And that's where the child protection social workers come in, and you may be at risk of losing your child. And honestly, mothers sometimes say, I wasn't the abusive person. I was not doing anything to my child. Why have you taken my child away? Well, the problem is you didn't protect your child. You didn't take a step to do anything that you get out of this abusive relationship. So that is a kind of a tricky point here. And that's something that should motivate these women to see that there is a time to take action now. Now, again, as Chris asked the question earlier, the parent in complete denial, how to bring them in therapy. Um, there are times when people do not try to focus on what is wrong with themselves. So, one of the ways of doing it is asking them whether they would try and come for 1 or 2 sessions for a family therapy, a kind of session where the whole family is there, or couples therapy. And the therapist will be able to help to show that how your behavior can be different and how your different behavior can have an impact on your family and your relationships. So often we start with more of a positive note. Often parents are very much in denial to say हमारे कुछ गलती नहीं है, जैसे सब हम लोग बड़े हुए थे वैसे हमारे बच्चे बड़े हो रहे हैं. We often try to do, and I'm sure Jyothsna will talk about it later, about starting positive parenting programs. And that can show people that there is another way of dealing with your child. You don't have to slap and hit and give cold treatment to your child if you're angry. You can learn to deal with your anger, you can learn to deal with your emotion and have a better relationship with your child.
And that's a question that Chris is asking. Is hitting a child a symptom of failed parenting? Because to be honest, in India, it's nothing. I mean, I know I hit my daughter when they don't listen and they're cranky, and you've come back from work, you're tired, you know, piche mein do laga do, or when they get to their teenage years, when they're giving you the lip, they have an answer for everything. Is that a sign of failed parenting? Because I know we all grew up being slapped here, there, everywhere. And if you lived in a joint family,
Mhm.
everybody free hand and free reign. Grandparents also giving this chacha, chachi, and nobody said anything. But is that a sign of failed parenting?
Well, it's a sad truth if I say yes, but it is in some ways because increasingly, when we look at how the world looks at child protection and child abuse, uh, things have changed. Things have changed from Victorian times, even in England, the birth of democracy in that country, and also things have changed a lot, even in Asian countries, Asian cultures. A lot of time, immigrants come to a different culture and country and say, we didn't have this. They just remember the time when they left their own country, that cultural
That's correct.
freezing.
Yep.
Yes.
But if you go back to India or Bangladesh or Pakistan, all these countries have got family law courts. All these countries have got laws and rules about domestic violence and protecting women and children. It may not be kind of the ideal scenario and 100% protection right now, but it is heading towards that. People are getting more aware. Parents are learning that rather than hitting your child, there are other ways of dealing with it. But as I said, sometimes parents feel helpless. Parenting is difficult. Parenting is
Yes,
not
absolutely.
easy.
Yes.
And we
All
need to
three of us are
empathize.
parents, and yes, you never stop being a parent, and it's a tough job.
And that's where it's said that you give all the support to the mother who has to give all her attention to her baby. So that's
Yes.
where the system, the socio-cultural family environment comes to the rescue of this parent. Sometimes women are going through what we call postnatal depression. They
Yep.
don't even realize that they
And we
have,
don't talk about it.
and people think it's normal, and they don't realize why I'm not loving my child, why I'm having attachment problems, and that's where they need help.
Yeah, I just thought of something and now I've forgotten. But I remember my mother used to say in Kannada, there is a saying, will you look after the baby or will you do, the housework? So that's a very close translation. And often everyone picks doing the housework because looking after the baby is the most hardest thing to
Yep.
do. And I think when mothers hit or they slap, I think it also depends on whether it's coming out from that intense hatred of that dislike or that active negative emotion,
Mm.
or it is coming from that ek fatka mara to start focusing, that
Yep.
type of thing. So I think that is also something to consider. And coming back to this thing about failed parenting, I think it has become such a judgmental society, this whole nuclearization of the family, and that's why women who were ideally supported in a joint family system,
Yeah.
with all the people, and so the parenting and parent, and let's face it, Indian, in our culture, we prefer to reproduce, not parent, because it is about the progeny, it is about the varis, it is about the name of the family. And to then consciously parent, I think we have to also reflect and be aware that we are raising a future citizen, who has civic responsibilities. And how do we do that? And I think when we are away from family in a place like here, I mean, if I didn't have a tribe, it's difficult for the mother to do, because who is she going to ask?
You're
Usually you ask, it's very hard.
Yep. Yeah, I agree with you
absolutely
because
right.
when my
Yeah.
daughters were born, my mother was there throughout. For the first
Hmm.
1 month, she was a professional, so she could only take a month off. But that 1 month, I did not have to do anything. My mother took care of all my needs and, you know, my girls' needs. And when she left, I was like, absolutely, I had no idea what to do.
And
I
then
found it,
that's
yes.
what a young mother needs. That's what a young
Hmm.
mother needs, to have that support and that care, because suddenly there's a surge in drop in hormones and change in your body. Sleep gets disturbed, feeding the child, all these responsibilities. It's a new world for a woman.
It is,
So
and the last 2 years, parents haven't been able to come and help their daughters. So
Yes.
that has made it harder.
it is
And
even harder in
South
lockdown.
Asian men are not geared to understanding what their wives or partners need. Well, most of the time it's their wives need, and I see very few South Asian men, in spite of living here, helping their wives through this journey, because it's a huge journey. And like you said, parenting is not easy.
And it doesn't come with a manual. That's the thing. If we
Yes,
have to, if we do washing machine, it's broken down, you can at least fix it. I mean, even IKEA is fixable, but this is not something you can fix. So,
that's what I tell my girls all the time.
Well, it
That
gets better with practice. That's the thing.
Yeah,
The more you
yeah,
get
yes,
to know your child, the more you pay attention to your child's need. The attachment between the bond between the baby and the mother helps the child to calm down,
yeah.
rather than
yeah.
getting frustrated and leaving your baby to cry, because then the child is not feeling safe, and then you are feeling more angry, and kind of goes into that cycle of possibility risk of being abusive to your own child.
So would you
Mm.
call this as neglect, Amita?
Well, this is neglect is something I think I need to talk about that, because
Yes, please.
neglect
Yep.
is the blanket which is wrapped all around the abuse, because neglect is something that is often missed. People don't see that. And one example, as you said, leaving a infant crying, a baby not meeting needs, not feeding the baby, leaving the baby wet, that is neglectful behavior. And sometimes we have to see whether it's, again, as I said, if mother is depressed, if there is anything going on with this mother, if she is too pressurized because of the domestic violence, that she is not able to focus on her child. But as the children grow up, neglect is often noticed by other people. So schools will see the child having dirty nails, same dirty clothing every day, sleeping in the classroom because they didn't get to eat breakfast in the morning. Sometimes children, they say that there's no one who does work in my house, nobody helps me with my homework. So that is neglect. Not taking your child to medical or dental appointments, that is another kind of neglect. Neglecting their medical needs, health needs. Not allowing the child to have a balance between education, play, and development, social groups, keeping child isolated, all those are neglectful behaviors, but they are so subtle that people often don't even realize that they have neglected. And sometimes even rich people are giving a lot of toys and things, but just you give little time to your
Yep.
child, you won't neglect their emotional needs.
You know what? This reminds me, Amita. This was going back a few years. We had gone to this Indian restaurant to have dinner, and there was this young couple. I think also because the minute you get married, there is so much pressure from the family to have a child, to have a child. And I feel a lot of us are not ready for that. Parenting and being a parent is not for everybody, and we still don't accept that. This couple, they had a little girl, would have been 4 5 years of age,
Mhm.
and she was very excited. She was doing stuff, she was showing her parents, both the parents on their mobile phones, one taking a photo and taking selfies, and I'm thinking she's on Facebook, you know and
Well,
and this I see so much. All youngsters are, they don't hold their head straight and straight anymore. It's all bent down. And this is what's happening with parents, the performance anxiety to show the world that, oh, I have this happy family, so posing with the child instead of actually listening. I mean, I just kept watching the child. Neither of the parents actually paid any attention to her, both of them
and
constantly on the phone.
I feel very scared when I see gadgets minding the child, gadgets
Yep.
offering parenting to a little child, because these are the same parents who will come back and complain and say, "My child has ADHD,
Yep.
my child has got behavior problems, very naughty, not listening," because they don't realize the impact of that screen, impact of that media exposure, and also not paying attention, not giving the emotional care that your child needs is turning this child into all these what you are trying to label with. But the child, you find they're absolutely fine. It's only the fact that they have to be away from these gadgets. Parents have to focus on the child and try and spend time with the child. So often setting up family rules about use of phones and use of
Yep.
iPads, joint family time, which is not digital time, all these rules can help the families. Yeah, it's a
But
very
again, this
tricky
is
world.
something that we haven't grown up with. So setting those rules is not part of our psyche, and oh my God, if you have a son, then that is it.
Well, in traditional, as Jyothsna was saying, the nature of the societal rules are very different. So, very collective societies like Asian cultural values, there were unspoken rules, and people followed those rules. There were hierarchy. There were things like how could people say, I never looked into my father's eye. I never answer
Yep.
back to him. Now the fact is, world has changed, and especially I want to tell the migrants: if you have chosen to come to Australia or UK or a country all the way, you have to accept that you have to accept the
And you have to
law of the
adapt.
land, and you have to
Yeah.
adapt because your child is attending school with local children. They are seeing a different kind of world there, and then if you try to say हमारे यहाँ ऐसे होता है हमारा culture ये, that is not going to work. But people have to really see the balance between these two cultures, because that is the most healthy way to help your child grow up having a sense of self, having a self confidence and self esteem about who they are.
This gives me a beautiful question for you, Amita.
Sure.
So, there is a lot of patriarchy and misogyny in South Asian cultures, and I can speak of Indian culture anyway. I'm very curious to know if you think that is there is there a degree of misogyny, patriarchy? Is there a difference, or is it just the same? Or do you think here there is more, there is gender focus? We know that, and that's what gendered violence is. But how do you think our culture fits in here? And you know, because I'm a first generation migrant and I also grapple with it, but at the same time, I'm very feministic in my views. So my son does, he says to me often that I think people might sometimes think I'm not, mom, I think a bit differently because I don't have any problems doing the dishes or doing laundry.
Mhm.
And my daughter does things at home too. So I just want to know what you think. And do you see these things in clinic?
Yes, I think that's a problem. That's the power differential, power dynamics, power imbalance that you would see because of patriarchal nature of value system and misogyny in our societal values. Because it's okay, whatever man is doing, and there was a quote about that men don't abuse women because society tells them it's okay, but they abuse women because society tells them that they are entitled to have control on the woman. And they are also, if they don't succeed controlling the woman, they are going to be seen as weak they are going to be seen as failed and be poor and alone. So this is interesting how gender-based values are instilled in children from generation to generation, thinking that women have to be subordinate to men's needs and they have to serve, they have to be in that role. Now, child abuse again starts right from that point, because what a child is getting to see is he can be entitled to all the privileges his sister can't be because she's a girl, or the mother is there to serve everyone. Her duties are paramount, but she is not. She doesn't have any rights. She doesn't have any value
And
in
even
this
if she's
family.
working, she's a professional, she still has to do that.
So the moment she comes back home, she is the woman and she is supposed to do. So there are all these value-based judgment about what a woman should or shouldn't do. And that sadly comes from the patriarchal value system that we all have for generations. I won't say, I would like to congratulate those couples and those families, the young generation who are actually learning about it and learning to value and respect women and partner. But sometime what we find, as you asked, Jyothsna, in clinical terms, there's a lot of pressure from families back home. So
And
extended
I was going to
families
say
are
that, yes.
say,
And
do
that
this,
is
do that.
exactly what, yes, yes. So I'll give you an example. Uh, Both my husband and I work. So the unspoken arrangement when the girls lived with us at home is whoever came back from work early or before each one of us would cook. And my husband cooks. He's a much better cook than I am. So you can imagine the kind of pressure he was from back home. Kyun kar raha hai, this, you are a man, you're not supposed to cook. She's a woman. And it came from women. It did not come from the men though.
Yeah,
You
and
know?
that's
So while we blame the men for everything bad in our lives, this whole misogyny is created by women.
It
What
is
is wrong?
enabled also. It
Yes.
is enabled. They feed into
Wow.
that
There's
narrative.
nothing
yeah.
wrong. There's nothing wrong. Today, now that I work part time and my husband works longer hours than I do, I cook. There is never a question of why are you cooking and why is Param not cooking? So,
And
why are we not being able to change our thinking? And I have
that's where
heaps
we
of
have.
questions coming in for you, so I can
Great.
see that.
No, I was just going to say we have to start early. We have to start educating our children to learn all the things. It's not this is boys thing, this is girls thing. They have to learn that there are basic life skills they all have to have.
So,
Yeah,
here
go
is
on
a
with the
question
question.
from Dilnaz then. Thank you for watching, Dilnaz. Why dolls, or why give dolls to girls and planes to boys? I think books and Lego are great unisex clothes. Okay, yeah, I know what she means.
And I
Um,
totally agree with Dilnaz.
yep.
Yes.
Yeah,
And
that's
Lego
here,
true.
books.
and said something else too. I agree because yellow is my favorite color, as you can see. Why do we have to give pink and blue clothes at birth? What's wrong with yellow? Dilna's nothing. When I die, I will be buried in yellow clothes. Uh,
So
yeah,
when
and
my son was born, he was born, here, but we brought him up for 2 years in India. I tell him even today that a lot of his clothes, they were pink, orange, yellow, and some grays and all. I don't remember consciously being shown blue clothes in India, and India is full of color. That vibrance, that busyness, the color, that is India. I came here and my daughter was born, and suddenly there wasn't anything other than shades of pink, And once I even measured the shorts, I wanted to buy her a pair of shorts, and I measured it against a boy shorts, and hers was a good half less. So, when we try and objectify based on gender, that then feeds into that patriarchy and misogyny, because it is a form of control. It is a form of control to say women should do this and wear this and दुपट्टा पहनो इसके ये ब्लाउज का नेक थोड़ा ठीक करो और इस साड़ी की पल्लू ऐसे पहनो. These are all feeding into those narratives.
Yeah, and
So
it's just confirming that women have to be controlled and
yeah,
also just widening the gap. I would say that Nas, if blue and pink can respect each other and also exchange blue for girls and pink for boys or yellow for all, that would be the ideal world for us.
And Dilna says, and Bichari Babi does not help, which is
No,
true.
no. No.
Okay, here are a few comments that are coming in, and I'd like to show this. So she's talking about it's so sad to see that in a Western developed country, we are seeing neglect and abuse. But these are cultural things that we carry from back home. And she continues with, we have to start from early learning, kinder libraries with storytelling to speak of equity and power control, gender stereotype. Yes, absolutely. I wish more people in the community, our people would do that instead of, kind of saying, okay, ladka hua hai, so let's just give him all the attention and the girl can actually just, or, as my daughter says, she hates this word empower, but we have to get women to talk to women. And
Well, we have to first accept that there is this reality of powerlessness and power imbalance. And that is the truth. That's sad. So we can't hide away from that. And I completely agree. Starting from early life, starting from the early learning center, helping these families to integrate with the broader community to see that they can have equal opportunity for both boys and girls. Those are the aspects. And teaching children and about gender stereotypes, teaching children about safety of both boys and girls, learning about neglect and abuse. I think all these things should start early on. And
absolutely.
even adolescents, for them to learn about how to respect each other in a relationship. I think those are very basic things that set the stone for a healthy family
And it
environment in
should
future.
start from home, from the mothers who teach their boys and teach their girls to be equal. Gender equity is such a big thing, but we are just not. And here we are, three women talking about this. Maybe we should start talking to the community, to the young parents, to
Yeah,
people
we'll
who've
take
just
that.
been married. Um,
Certainly.
Yeah, and
here
I think
is
this is a perfect time to say that Indian Care is running interactive workshops on fostering healthy relationships, which will be facilitated by Dr. Amita Sarkar. And this is to launch our 16 Days of Activism campaign. So, all of you young parents with young children who want to know how to nurture a child in a healthy, successful environment at home, then please register. We've shared the link on Indian Care Facebook. And thank you again, Amita, for making yourself so insanely accommodating and available for
Thank
everything we
you.
want to do with the community.
No, it's a pleasure, and I just want to tell the parents, just give yourself a chance. You are beautiful. You love your child, and you want to do best for the relationships, and it is possible. Change is possible.
absolutely. There's nothing called impossible. Um, so, wow, this is so good.
I can just visualize Dilnas even
Bravo.
saying it, that's amazing.
Yeah, my girls did that. My mother was shocked. My mother was a very, very, as you read this morning, very smart, ahead of her times. But I remember when we were renting the house that we were renting in, did not have a dishwasher. So my daughter was not yet 10, and my husband's like, wash the dishes. And my mom's like, Nana, কি করে করবে বাচ্চা মেয়ে না I was like ma she's got to live here, she's got to do it. But my mother was, it was nothing to, in my house there was no man involved in the sense, I've got two girls. But yes, but learning how to make lunches, and my younger daughter actually made lunches for all of us from the time she's come. So Dilnaz has something else. Even Asian communities have gender bias. Yes.
Yes,
That's
yes.
It's
Yes.
not just about South Asian; it is about
Yeah.
Asian communities.
I think it actually cuts across cultures and races and ethnicities, because I
Yeah,
think it's the patriarchy and the misogyny, the structure. It's not so much the gender bias that feeds into that overall patriarchal
Yeah.
structures and constructs.
yeah, and there
I
are
have, yeah.
different communities.
Absolutely. I'll
Mm.
Even
show you something else, and I'm going to go back to Chris's questions because she had a few. So I was at the Blackburn Gurdwara for. Was inspiring to see all genders of children and youth serving the community in the langar. I have to say, I love this concept of seva amongst us Sikhs. So yes. Question from Chris for you, Amita, is
Sure.
can a parent gaslight a child?
Well, sadly, yes, it is. It is something that can happen, and I would say I've seen that happening, and
Really?
that's the sad and more extreme part, and it's rare. Um, but in the end, what you could see, the parent was going through her own difficulties, um, and that had to be taken care of a treatment. But then law is in its place. They were prosecuted, and there was punishment at the end of it. But sadly, and that's where being aware of child abuse and child neglect is important, because it starts very slowly, just like fire. Initially, people don't see, and they may see little bit kind of issue there, but people don't realize that if there is no early intervention, it's very hard to know when it's going to cross the threshold.
I just would like to ask you, Amita, are you able to give us an example of what gaslighting
Yeah, I was
is?
going to say that, yes.
Yeah, because I think it's very important to know exactly what it is.
Yep.
So it could be in terms of really thinking about domestic violence situation. And one example is a child killing one parent
What?
on on an occasion where he was I don't know, I would say emotionally blackmailed, but also really emotionally drawn into parental conflict, and siding with one parent. This child ended up killing the other parent who was abusive. And you realize there are deeper issues with the parent, like mother, who actually instigated all this with the child. So it could be that risk, and that's why I'm saying that the emotional abuse was going on for a long time, where child was drawn into this domestic conflict. The child was drawn into it, and people just didn't look at it. They just thought कि husband wife का झगड़ा हो रहा है, कोई बात नहीं है. But a child is absorbing that conflict on day-to-day basis. The child is soaking in all that hatred towards one parent against another. So in the end, who is to be blamed? Who is, because there was prosecution and there was kind of end of future for this kid.
Hmm.
But it's really
So
really sad situation.
When we
very
were in
tragic.
Delhi, I remember, uh, I think must have been 15, 16-year old. This young boy killed his mother because she used to nag him every day for whatever. She just killed him.
Yeah, that's another example. The child getting fed up of constant ongoing abuse and neglect, and they reach a threshold where they just think, or as a child they were controlled, they were abused, and as they grow up, as they grow older and physically more stronger than the abusive parent, they just take a revenge. They just lash out and take it out on the parent. And if that doesn't
Hmm.
happen, sometime it is on their own partners or their own children. So that's where the intergenerational risks are there.
Hmm.
Okay,
Hmm.
this is an interesting question for the two of you from Chris. Amita and Jyothsna, I would like to know your views on responsible procreation.
One aspect to that is in the current scenario, when parents, and again, if parents, two people, partners, husband or wife, or living together, they decide that they want to kind of go ahead with the family, they want to have a child, they should make sure that they are ready for that. They shouldn't do it under pressure that other people want it, or my friends are having kids, so I should have a child, or my in-laws are saying, my parents are saying, you should have a child at this age. All those things are secondary. You have to be ready for it. I'll let Jyotsna deal with the rest of it.
Yeah, very clever. But I was having this conversation this morning with another friend of mine, and I totally agree. I think women particularly need to feel um, they need to be aware of the responsibility that comes with childbearing and child rearing. So there is a physiological aspect to it. Yes, there is a biological clock that ticks away, and there is all this thing about healthy egg. All that is true. And but there are strategies where you can look after yourself to have a healthy baby. So that's totally possible. And from a societal thing, I think it's very important to form your own tribe. Develop a tribe that will support you through the process, because let's face it, men don't get to do this, we do. So let's make it as enjoyable an experience as it can be. So connect, talk, discuss, attend parenting classes just as a bystander, and go and listen to what they say, and as an audience to see. And when people tell you it is hard, they're not lying. It is hard, it is difficult. So be aware that it is a difficult journey, that it's not all about the baby shower and the beautiful pink and blues and the cards and everything. It is intense. There might be time when you can't breastfeed, the baby will be crying, and you will feel like saying, what did I get myself into? But if you're aware of it and you fill your own cup before you look after your baby, it is possible. And there are plenty of women in Melbourne from first generation, second generation migrant South Asian communities who are very willing to help. There are plenty of grandmothers who, I know a few who will say, why didn't you tell me? I would have told her that's fine. So call us and ask us at Indian Care. We'll try and find someone. But do it with awareness and own that decision to have that baby. You've had it for yourself. The child didn't ask to be born, you chose to give it birth.
That is what my elder daughter says to me all the time. I did not choose to be born. You popped. So yeah, yeah.
That's
And
true. And
and it's okay to feel depressed, because I had a lot of postnatal depression when my younger daughter was born. But when my elder daughter was born, from a really hectic working life, I had to stay back home for 4 months and not work. And when I went back to work after, in my fifth month, it was lovely. And I felt so guilty leaving her behind. And I'm thinking, I must be a really bad parent to enjoy my work so much. But you need that time for yourself too.
Yeah.
and
And
Here
I,
you
it is
have,
yeah.
true that the quality of your interaction with your child is more important than quantity of time you spend with your
absolutely.
child.
And you have
Yes,
the option here to do, um, part time jobs, which you don't in India.
yes,
India,
true.
Yeah.
we never
And
had all those opportunities.
true. And I think we also tend to think of things in binaries, and it's not. It's
No.
never black and white. There are always shades of gray. And,
Yep.
this is my favorite thing, it's intersectionality. We have to support at every point and offer that helping hand. So have the baby if you desperately want it. There is a whole big community to support you.
Okay. I want to talk about children with disabilities.
Sure.
How do parents behave if they have a disabled child?
Well, one of the things that is important to remember is having a disabled child is a challenge, is a difficult scenario because the child presents with the physical or psychological disability. That means the child is not functioning at the level of age they should be, which is sad for the parents to see. So having that sadness of losing, not having that normal child that they could have had is a sad part of thing, but also looking after a child with disability can be a challenging task day in day out. Now interestingly, paradoxically, what research shows that the severe the disability is, less chances or less risk of abuse, because children who are
Really?
on the more severe end of disability, they get the support, they get the care, they get sympathy from the community, parents get more sympathy from the community. It's more of, often children have some level of difficulty, mild to moderate disability, but they can be functional, they can still
Yep.
walk or talk. Those are the children, they actually are more at risk of emotional and physical abuse, because parents often do not understand that this child is going to school, they can talk, but why are they failing in subjects, or why can't they run and play football like other children, or why can't they understand. So there is that frustration of lack of understanding, lack of awareness of what disability means, but also the pressure of protecting this child, caring for this child, because this child is not growing like other children and going to kind of be independent, average adult. This child is going to need help for a long, long period of time. So that can be a challenging part, and that's where if parents are not getting enough support to deal with those challenges, there could be a risk of child abuse. Sometimes there is domestic conflict because one parent is wanting to care, the other parent is in denial or rejecting the child or blaming the parent to have a birth of a disabled child. I think those things can create an environment of domestic abuse and violence in the family. So a lot of support is needed, and I would say in Australia there is a lot of support available, and people should come forward and ask for help, and it's there for them.
Thank you. Chris, we can see all your questions. Unfortunately, we are running out of time. Um, so before we end and before I let Jyothsna do the closing and you do the closing, I want to ask you, being treated by parents the way that we have just talked about, does it affect the child when they grow up? Um, and what kind of effects can it have?
It depends on two factors. One is how prolonged that abuse was, how long and how severe it was. So severity, duration, but also lack of having any other supportive relationship. So sometimes there could be children who had abuse in the childhood, but they had a protective parents, they had grandparents or someone who was a positive influence on them. So that could be a mediating factor. But thinking about what kind of problems there, people just didn't think about mental health problems of depression or anxiety, but it can get into like eating disorders. That is a very common part where there's a sexual abuse, physical abuse issues can be the basis of that. Also post traumatic stress disorder that happens, substance alcohol abuse, but more than that, physical illnesses. And it's interesting, there's very little knowledge people have, but the research has shown that people go into heart problems, neglecting their health, having heart disease because there is obesity. And those are the people, adults who grew up not caring for themselves because they were abused, made to believe that they don't deserve to care for themselves. So that self-care element goes away. And then the more severe end would be sometimes find the children being abused turning into perpetrators. So criminality or being abusive in marriage or abusing their own children. So those are intergenerational influences that can happen.
Thank you. Joe, you want to ask Amita any more questions?
Uh, I just want to know how can parents change their. I mean, I know that it is behavior, but how do we do that? So we
How do
try
we
and
become
get,
better?
yeah, psychodynamics, learn
Well,
psycho.
That's something
so
most people listening will not understand.
Yeah, I think Amita got it, and she'll probably
So,
say it anyway.
so the whole gamut of psychological help, emotional help, social help, the practical help that you need, as you said about grandmoms in the community helping you. Practicality is about financial, social support. I think all that is important. Also, finding ways to deal with your stress. So one of the tricks we say, and we'll talk about more about it on Thursday, Jyothsna, is learn to press the pause button. How you identify yourself when you are going to lose temper and going to hit your child or be abusive or neglect your child's needs. Time out for yourself, self care. I think that is important. But also at the community level, we have to have campaigns to educate people, educate children as well as educate grown ups, adults, and parents. What are these long term effects of child abuse and neglect that we should protect our children? We don't leave our child running on out on the road because we don't want them to be hurt. Why do we want to get our children be exposed to something that can emotionally hurt them? So, and I'm sure a lot of time most of the parents, when they get the help and advice and other techniques, they will be able to do it.
Yeah. I think, to be honest, all of us want to do the best for our children. in
Yeah.
whatever convoluted way you want. But I think I inherently believe in the goodness of people, and I always feel with children, you always want the best for them. I mean, I may be totally wrong, but
No,
and again,
it's good.
as Jyothsna said, there is no handbook for parenting. We uh, we can only try our best, and I hope that trying is better than what we are doing at the moment.
Yeah.
um, Thank you, ladies.
Thank
It's
you.
been, as always, awesome. Right on the dot, 1 hour. I will share this on YouTube, and for you guys to share it further. Thank you once again, Amita,
Thank
Jyothsna, for joining in on a day you're not supposed to, but thank you very much. Good night.
Pleasure.
Okay.
Thank you.
Bye.
Good
Take
night.
care. Stay safe.
Goodbye.
Bye.